I joined online courses. And then I found that, sirs, your course was really helpful for me, because only after joining your course, I came to understand how to do that long clinical consultation.
Mhm.
So I would like to advise everybody not to spend too much time on books. It's better to join online courses, because you can save a lot of time, and moreover, you will know how, you will learn the tricks to crack PACES exam. The books will just give knowledge. They won't, you know, give us the tricks, or they won't, it's not just by reading books we can't crack PACES exam. That's what I understood. And
Mhm.
another thing is, I have joined other courses as listener also. Being a listener did not help me much. We have to be active participant. The reason why I joined as listener was, I lacked confidence. I thought I won't be able to do well. I don't know how to present. But only when I joined as an active participant, I understood my mistakes. So we have to practice as an active participant. Listener won't help us to appear. For just by being a listener in any course, it won't help us much. That was another mistake which I did, sir. Then, then regarding my PACES examination, on the day of examination, I was actually confident before going for the examination. I was actually confident that I will get through it. But then I started with station 5, which was actually a lymphoma case, but somehow I did not do it that well. So what the mistake which I did was that, even after that station ended, the next station was station 1, which was communication. I kept
Mhm.
on thinking about it in the next station, that is communication station, and I wasted my 1.5 minutes or 2 minutes. I did not even read the question. I did
Uh,
not
so,
read the scenario.
so that is the takeaway message from you,
Yeah.
that at the day of the exam, you will think of the station you did, either it went well or not. You have to forget and to move forward to the next station.
Yes, sir. Because I wasted my two or some, I think 2 minutes or something I wasted. Then only I read it very fast, and that was another big blunder which I did, because I was kept on thinking about what went wrong in station
Mhm.
5. So that really affected my performance in communication station. It was a HIV case, and it really affected me.
Mhm. Mhm.
Then another thing, sir, is that in all the stations, the examiners they don't have any expression on their face. So I
Mhm.
was expecting, like, when we go and tell our diagnosis or the positive findings, they will nod their head like, yes, what you're saying is correct, or
Mhm.
they will say no. But
Mhm.
since I did not see any expression on the face in all the stations, I was like, oh my god, what I'm saying is wrong. I think I won't clear the station. So it just pulled down my
Mhm.
confidence so badly. So
Okay, okay.
so never to so just I would like to say, don't look at the expression of the examiners and don't judge
Mhm.
anything there.
Yes, yes.
And there's some examiners were keeping an angry face, especially respiratory station. He was keeping such an angry face. I thought, okay, gone, my respiratory case is gone, everything is gone. But when I got the marks, I got 20 out of 20. So that
Mhm.
thing, yeah, so I was shocked. Like, in some then another thing is that, sir, in I don't know, in some state, just tell the findings which you get and which you are
Correct.
100% confident.
Yes, don't make any sign. That is the.
Fine, yes, sir. Because in my cardiovascular station, it was a midline sternotomy scar with pulmonary hypertension. Even though there was no murmur, the examiner asked many of the candidates, like, is there any murmur? Did you get any murmur? So just because he asked this question, some candidates committed the mistake of saying, yes, there is a murmur. But definitely there was no murmur. So even in my respiratory station, in the end, towards the end, I was sure that there was no clubbing. But the examiner asked me, did you see clubbing? Is there clubbing? He asked me. If I would have told yes, I would have definitely lost marks. So it's better not to say any findings which we don't get.
Mm.
Yes, sir. Then finally, sir, talking about this exam, it's totally unpredictable,
Uh,
because the stations where which I thought, like respiratory station and all, looking at my examiner's face, I thought I'll get zero only. But the
mm,
stations which I thought that I'll really get low marks, I got really good marks. And the stations where I thought I did very well, I lost some marks. So this exam is totally unpredictable till we get the results.
yes, yes, that's you are right. So, Dr. Sina means consultation station.
Yes,
what do
sir.
you think? You will have time there or not? Or you
Sir,
think that you need more time, or time is not enough, or you have enough time? Because many
sir,
candidates
consult.
ask me
Uh,
in the new pattern, means
mhm.
how the candidate who appear in the exam, they feel like that, because before there is no time.
Yes, sir. Yes.
Mm-hmm.
So what I felt is that both the cases we had practiced actually. One was a long-standing fever, and the other was thyroid swelling. So since
Mm-hmm.
we had practiced it, I was able to manage the time properly. I was able to take history properly. I was able to examine everything. I was able to ask the concerns. So what I felt was it's the practice, practice, and practice. Because the more you practice, you will know
Mm-hmm.
where to stop your history, where to start your
And
examination, and
even
when to ask
and even
concerns.
you know that what time is still left, without
Yes,
any
sir.
watch,
Yes.
means without wearing any wristwatch, you know the time, exact time.
Yes, sir.
You practice
Yes.
for
Yes, sir. So it was just practice, and there I felt that we can't think anything. It just has to come out of our mouth. There's no time to think. It
mm,
just has to flow, and it'll flow only when we practice.
mm.
Practice a lot, so that's all.
And Dr. Sina, advice to those candidates who are going to appear for Chennai Center next time. Your advice, the what they should do, and how was the center, just to they
Uh,
become more aware
okay.
about the center.
Okay. So Chennai Center actually, I cleared from Sundara Medical Foundation.
Mm-hmm.
Actually, they are very in the beginning itself. They were very warm. They were like very kind of cool. They just told us to relax. So yeah, so when we went there first, we were a bit tense. Then some examiners came and they told us relax. It's going to be easy. And after that, when everything started, the cases were not straightforward, sir. It was not straightforward. But what I understood is that if we just tell our findings and if we are able to give differentials, we can definitely clear the exam, sir. That's what I understood from my experience.
Mm-hmm.
The cases are not straightforward. They won't give you just straightforward cases like with this and this finding, so you can come to a
Yes.
conclusion. No, it'll have so many findings. Tell only the findings which you get and offer differentials. That is enough, sir.
Differential, yes. That
Man,
is the main
yeah,
thing. Mhm. What we
yes,
did
sir.
the mistake, we go for only one diagnosis, okay, and we stick to it.
Yes, sir.
So this should not be done. Huh? Yes, you are right.
Yes, sir. And then they're asking investigations management, and within that time itself, I mean, the time is getting over. Investigation management, that's all, sir. Nothing more. They're not asking anything else. First, tell
So,
me your positive findings. They are telling first, tell the positive findings. So the moment you say that, then they're asking, how will you investigate? How will you manage? Then yeah, that's all, sir.
that's
That's all. Nothing much. Yeah.
and they will ask you extra question only if you did very well and still time there.
Uh,
Otherwise, there is no time for that. I think so,
no
no?
time. Yes, sir. Yes, sir. Yes, sir. Yes. So, yes, sir. So rather than wasting our time, which I wasted like 2 months in books, a rider and OST and so many books, but that won't help us much to crack paces.
I
Online courses help me a lot, sir, especially your course. Seriously, it helped me a lot.
I always tell my candidate about you that when you look at the examiner, they are writing on the paper HIV
Yes,
plan.
sir.
Yes.
Yes, sir.
So this is a
Yeah,
good
that.
thing.
Yes, sir. That is another thing. We should not look at what we should. It's
Uh,
better we don't
not to do.
observe what they are doing because they keep
Yes.
writing something, then they just stare at you. They keep angry faces. I don't know. They have this mask-like faces, which will just at that time, if you keep on thinking all those things, we'll get really scared and we will lose our flow, sir. Which happened to me actually. I was thinking what they are writing now. I was looking at their face, which made me
Mhm.
actually lose my flow in communication station.
So, Dr. Sina, to just five advices you want to give for those who are going to give, even less, no problem. So, your means takeaway message that
Sir,
what.
my takeaway message is that, sir, first, before the day of the exam, just relax. I know it is very easy to say this, but it's tough. But relax. Everything will depend on God's grace and our fate on the and our
Mhm.
luck on that day. So
Okay.
relax. And then another thing is, please, please don't think about your previous station. in your when you're going to do a new station 1, please do not think about your previous station. It will affect your the new station, because for me, I lost my marks badly in communication because of this mistake. And do not expect yes or a no or any facial expressions from the examiners. They will all have same face, whether you tell the correct answer or the wrong answer, the same expression will be there. So that also affected my confidence a lot. Then please tell only the findings which you get, because they will ask you, was there a murmur, was there clubbing? If you didn't get, please say no, no sir, I didn't get. Because I mean, we shouldn't fall for their trap. Then sir, then I would say not to, I don't know whether it's a good advice, don't waste much time in books. Yeah, which
Yes, you
I
are right,
wasted my
doctor.
2 months.
Yes,
Yes
those
sir.
who did not appear in the exam, even if you will tell these things look like how it possible, but once you will, anyone who has given the exam before, they know it, that this
Yes.
exam is not about the knowledge, it is about the practice.
Skills. Yes sir. Yes.
Different skills.
Yes sir. And the differentials also now is carrying more weightage than previous pattern. So differentials also we should be able to I mean, at least give some 2 or 3 differentials, I think.
Okay, Dr. Sina, so thank you so much for joining.
Thank you sir.
Okay, and giving the feedback. Okay, so anyone want to ask question to Dr. Sina, you can ask, other than exam scenario, anything you can ask, or you can ask in the chat box. If she will see, she will try to reply. In between, I think we should.
Hello,
Yes.
doctor.
Hello.
Yes, doctor. I just want to ask one question. Like most of the people say, when you are doing a case like long clinical consultation, then at the end we have to tell all the investigations and management plans to the examiner. So for that we have to read some books like Oxford, at least, to have knowledge of the disease at least. Otherwise, it's all about practice. So what she thinks in this regard, if she can guide us.
Okay. Well, my from my experience, because I had only few months and I read a lot of books, it's difficult to recollect everything. The investigations and the treatment are so elaborate in books. But when you take an online course, like for example, Dr. Huda's course, if you take for about 2 months, or I mean, 1 or 2 months, on repeated practice, it'll get into your mind. You don't have to study. The investigations and management will automatically get into your mind. Plus we are all doctors, we see a lot of cases, right? So when we see cases and when we practice also, the investigations and management will automatically get into our mind. So yeah, maybe to get maybe a background knowledge, maybe we need to have just a rough
And I
to have a
think,
rough idea, maybe we have
yes,
to read
most of
books.
us, Dr. Sina, I think most of us also already passed the part two. So
Yes
we
sir.
have a background knowledge of investigation management, but they don't want very means a strange name, common investigation.
Yes sir.
Okay. Because
Yes sir.
the examiner is from the different specialty and they are not on the same station. Okay, so they also not have much idea about, so the basic investigation and the routine investigation like this, if you will tell, you will get full marks.
Yes sir.
What we waste our time memorizing difficult things, and actually we lost our time.
Exactly, sir. These are the mistakes I did. I wasted a lot of time actually reading books and learning so many things. But after giving the exam, I felt, why did I waste my 2 months on these books? It's just the basics they are asking, just the basics.
Hello.
Hello.
Uh, First of all, salam to sir. And Dr. Sheen, I have a question from you.
Yes.
That, yeah, we know that differential diagnosis is a separate skill, right? We have to pass their
Yes.
separate skill. But I have a question that sometimes in the long clinical consultation, we have a different diagnosis. So So making other differential in that case seems quite difficult. Like, for example, if this is a case of acromegaly, and anyone can diagnose that from far away. So how to make other differentials in such like things? Like there are many, many scenarios in which only one diagnosis is fitting.
Okay. Sir, regarding this, I don't know regarding this because I think sir will be able to guide this. I mean, to help you in this regard. So, Dr. Huda, I don't know how they will give marks regarding this.
No, there are some scenario where there is only one diagnosis. Okay. So, but still you have to keep differential diagnosis because this is a skill. So suppose someone has pulmonary embolism. Okay. So typical features are there. Suppose saturation is low and everything is there. So, there is a typical history there. Okay, long haul flight, everything is there typical. Okay, now it's a pulmonary embolism. Okay, but they will ask you other differential. So definitely you have to tell that it could be a pleurisy secondary to pneumonia. It could be pericarditis like this. Okay, and you have to give the negative things. Okay, it will then only you will get full marks. If you will say pulmonary embolism and if examiner will ask you, tell me the other differential, and you say, no, doctor, I am sure this is the 100% pulmonary embolism, and you will not tell anything, they will give you borderline. Okay. Many candidate like this, they did the mistake before. Okay. And in the feedback, it was clearly written that the candidate did not mention the other differential diagnosis. So don't means try to mention. Okay, even it is myasthenia gravis, like fatigue myasthenia gravis. Okay. Okay, so it is nothing you can see say that in the evening. So you will say that it is not this because this is in the morning, or he feel tired in the morning. I did not find pallor like this. So no issues. Means you have to rule out other differential also, and you have to tell the differential of fatigue.
Okay, sir.
Dr. Kamran,
Yes, sir. I got it. Yeah.
So like this myasthenia gravis, there is no weight loss, nothing. A simple female there, young female, typical history of medication or trigger is there. Okay. And she feel telling that I feel tired only in the evening. Okay. And all symptoms are in the evening. So there no differential will be there, but still you can keep a differential like anemia. Anemia will not have any weight loss. Okay, but why? Because there is no pallor is there, and we feel tired only in the evening. Anemic person also, they can feel tired more in the evening. Okay. So like this 2 or 3 differential, definitely you have to give at least minimum 3 differential.
Okay, sir. Sir, regarding investigation, should we justify our each and every investigation, or just we have to make a list of investigation?
Correct. So means every investigation we should cannot justify. Okay. Correct. So means like someone you think, suppose give an example, someone has bronchiectasis. Okay. Okay. So definitely you will do chest X-ray. Okay. You will do HRCT and you diagnose the case. But still you have to tell pulmonary function test. Clear? Okay. You have to tell like this. Okay. So these are the things, means still there is no sense of doing pulmonary function test, but still you have to mention, because there is a obstructive type of features will be there, or restrictive type of features there. You just want to confirm it. Even it's not a diagnostic test.
All right. Thank you, sir.
But if you will say something like, I will do a different type of different test that is not required, then they will minus you. Otherwise, no doctor. I think so.
Hello, sir.
Yes.
Sir, I have a question for Dr. Seema. First of all, I congratulate her.
Thank you.
And Dr. Seema, would you like to please share your cases with a short brief with finding?
Yeah, sure. First I started with long clinical consultation, station 5. It was actually a male patient, I don't remember, I think 40 years old male patient with fever for 1 month. And yeah, that was the case. So the surrogate was telling me he's having fever for 1 month on and off. He's taking antibiotics. Only when he takes antibiotics, the fever comes down. And then again it comes like that. She was leading the case. But then when I asked about night sweats, yes, there was night sweats were there. So then actually they wanted differential and physical findings. I did not get anything. I did not get any physical findings. But some candidates told there were lymph nodes and they told like that. So I thought maybe I missed the findings. But when my results came, I don't think so. I mean, when my results came, on seeing my marks, I understood that there was no findings actually. I told that to the examiner, and they want a differential diagnosis for actually long-standing fever, for example lymphoma, TB, and he was a smoker, so I told carcinoma lung. So they wanted differentials for that. Then for communication, my case was that HIV case, like a patient with positive cytomegalovirus, and now the first a test came out as positive, which was another patient's, and then the second test came out negative. So you have to convince him for a repeat sample. Then my respiratory case was actually a fibrocavitary lesion with COPD changes as well. Then my CNS case, actually, I offered differentials. It was I offered two differentials. One would be motor neuron disease and polio. Then my cardiovascular.
Can you,
Just a minute.
can you please repeat the CNS?
CNS, I offered differentials, like it was an LMN case. So I offered differentials, like I was no, it was not a clear cut case actually. So I offered differentials, like it could be polio or it could be MND, but they were happy with both the differentials. And they were asking me questions on investigations. How will you investigate MND? How will you? What is the treatment for MND? What is the investigations for polio? It went on like that. Then my cardiovascular system was a midline sternotomy scar with pulmonary hypertension. That's it. So they were asking me differentials for midline sternotomy scar. And what else? Yeah, how will you manage? The discussion went on like that. Then the abdomen case was actually polycystic kidney disease with AV fistula. I think I told it. And one more communication. Yes, one more communication was there, which was about end of life care. A stroke in a very old lady. She's having a massive hemorrhagic stroke. So you have to talk to the granddaughter regarding end of life care.
Sir, sound is not clear.
Okay.
Do you want me to repeat it again? Communication?
Yes.
Yeah, communication was end of life care. A 102 years old lady, she had massive hemorrhagic stroke. So you have to talk to her granddaughter regarding the end of life care. That was very easy. That's all. Breaking bad news. Then my other consultation, long clinical consultation, was a neck swelling. But findings were just a diffuse thyroid enlargement. That's it. That was only findings I got. And the neck swelling, thyroid case. It was easy actually. That's all. These were the cases.
Thank you, Dr. Sina. Thank you so much.
Thank you, sir.
For
Thank you, sir.
your experience. Okay. So we all wish you best of luck for your future.
Thank you, sir.
Okay.
So
Thank you.
I have a question for Dr. Sheena.
Yes.
Sheena, hi, Dr. Manisha. Yeah. Congratulations.
Yes, thank you.
Sheena, I just wanted to know that, for your respiratory case, you said it was a fibrocavitary lesion. I mean,
Yes.
how do you, without the X-ray, how will you know that it's a fibrocavitary lesion? COPD, I understand,
Okay.
but
Yeah. Actually, he had
fibrocavitary lesions.
drooping of shoulder on the left side, and when I did vocal resonance, it was increased on the left side. And since I was drooping of shoulder, he asked me the differentials. And so I told it could be fibrosis, it could be a cavity, a fibrocavity lesion. And but when my marks came, that station I feared a lot, because most of them told many people, all five of us gave different differentials and diagnosis. But when my results came, since I got full mark, I believe it is fibrocavity lesion.
Okay. So he had, they expected that. Okay. Because, it's
Yeah,
difficult without the findings to comment on, or the
yeah,
X-ray.
that's what.
Okay.
And
Thank you.
oh, thank
Hello,
you.
Dr. Sheena.
Yes,
Congratulations. And
thank you.
I just want to ask that what is fibrocavitating lesion?
Well, in tuberculosis, in old TB case, you get this fibrosis plus you get cavity also. So
Okay.
in old, in previous, maybe that patient might have had tuberculosis before. Now there is fibrosis, then he's having cavity also,
So how you know that there is a cavity present?
because the vocal resonance was increased on that side.
Okay, like fibrosis plus vocal resonance increase.
Yes, yeah, there was drooping of shoulder on that side. So volume
Okay,
loss is
okay,
there, plus vocal resonance was very nicely increased on that side, left side.
okay, okay. Okay. Thank
Okay.
Okay, okay. Thank you so much, Dr. Seena.
Thank you, sir.
Okay, for sharing your experience with all of us. Okay.
Yes, sir. Thank you, sir.
Okay, okay. Thank you again. So I
Okay.
think another candidate who went for the prayer, I think so. Dr. Muhammad, he texted me that he went for the prayer because there is a prayer time there. So Dr. Nabil, are you there?
Assalamualaikum, sir. Yes, sir. I'm here.
Assalamualaikum. How are you, Dr. Nabil?
Alhamdulillah.
Many
Still
many
adrenaline
congratulations
rushes.
again.
Thank you very much, sir. Thank you very much.
So introduce yourself and share the experience with our candidates.
Right. Okay. So I am Dr. Nabil. I am one of the very few countries you might have heard doing PACES exam. I am from Sri Lanka and I'm from Colombo. My PACES center was in Colombo, and I had, I think, about probably 2.5 to 3 months to prepare for my PACES exam. Because luckily I got a seat very early after doing part 2 in February this year. Within 2 months, I got a seat to sit for the PACES exam. Before I joined Nasim sir's course, it was I had a sort of an idea. Okay, this is it, but there was no structure. That means, okay, if they ask subarachnoid hemorrhage, I know the questions to ask. I know this thing. But then when they ask, maybe, what is your differential diagnosis? Then I have a doubt. Okay, what should I answer? Or what am I going to think of? So there was a little bit of lack of experience for me on my side, I must admit, because my background is gynecology and obstetrics and pediatrics. Internal medicine, maybe only 2 months I would have done it as a relief house officer. But Alhamdulillah, Dr. Nazim, sir, I must be very thankful for him from the beginning, because he really provided this structure, like what you should ask when any patient comes with headache. So I strongly recommend when the sir is doing a code, when the sir is doing a case, headache, he covers all the headaches with it. That's what he did for us. I think it's the same, sir.
Yes, yes.
So he gets the diagnosis and everything. So how is it different? And what are the questions you might be expected to answer? I mean, what the questions are going to be asked towards you from the examiner's side? And the best part is, more than this, it was very nice because sir was always live in the WhatsApp group. Sir was always answering questions. And you have lots of support beyond this course. And Alhamdulillah, I found my PACES I honestly should thank Naseem sir, because Naseem sir is the one who introduced me in my group. There are 3 doctors. I believe there is a Dr. Kamran who is there,
Yeah.
Dr. Ansari, and Dr. Jennifer. These were my 3 buddies who really helped me. So we got through Naseem sir these contact details. He sort of formed us into okay, this is a group waiting, and then I immediately texted them, and alhamdulillah, they were my backbone. But it was all good. But one thing I can tell you guys, it's not as hard as you think. You know, before the exam, I was thinking maybe they will give some cases very hard, maybe pot syndrome. Recently in Lahore or in Islamabad, they asked about postural orthostatic tachycardic something, some syndrome. So I was like, if they give that case, what am I going to do? Post-COVID syndrome. It's not like that. I mean, you might get it, it's your luck, but it's not as hard as you think. Regarding books, I don't think books are going to help you much, because the questions are going to be very straightforward and not hard to answer. It's just how to present in short time, how to do the examination in a very short time, examination, and what are the most important questions you have to ask. Like some questions, for sometimes, do you have any pets at home in respiratory case? That's added points. That shows that you have to just show to the examiner that you're a seasoned candidate. That's the first thing they look for, whether this person has practiced before. So the moment you start, okay, hello there, my name is Dr. blah, blah, blah. I'm here to ask a few questions from you. Is that okay? Okay. So do you want anyone else beside you in communication case? So that flow should be there. And that flow, Dr. Naseem sir gives us every time. When you don't do that flow, the sir will again stop you and say, no, please improve the flow. And I remember, sir, in my last 3 sessions, that was the first time sir said, okay, Nabil, now you're in the right track. I still remember, sir. You can also say, yeah, I still remember.
When you start a station, it will give an impression to the examiner instantaneously. Yes. So examiner will have an idea about the candidate that, okay, this candidate has practiced very well. Okay. Because for examiner also, I talked to few examiner. Okay. So they told me that for them it's difficult to concentrate, because we are giving only one exam 2 hours. They are as an examiner 6 hours. Okay. So it's not easy to anyone to concentrate continuously for 6 hours. Okay. It's not easy. Means after giving one exam, we get so much tired, and they are also like that. Okay. So so the first impression is the best impression. Okay. Yeah. Continue, Dr. Nabil.
And how fluent you are. In communication station, hello there, I'm Dr. This and this from what department? If it's acute, you can understand. They will say you're an acute medical unit or rheumatology clinic or medical ward. I'm from here. So I'm here to ask, I'm here to talk to you about your health condition. And if it's not an infective case where sexually transmitted disease or genetic disease, do you want somebody else to accompany you? Okay, so how are you feeling? And could you please tell me about your medical condition? This should come in a flow. You should not think. It should come like like that, like when you're going to pray for Muslims, I'm saying. Like that, it should come like a flow. That flow you will develop only if you do mocks and do, revise and practice and practice. And when you hear always the same things, you will automatically do it. Trust me, guys, I was not very confident going in. I was a little bit confident going into the exam, but alhamdulillah, with the help of Dr. Naseem sir, I managed to get very good results, actually. Very good results.
Very good result, doctor. We are proud of you. Yes.
Purely. So if you have any questions or anything, you can ask, or it's okay, Naseem sir.
Dr. Nabil?
Yeah, yes, Dr. Kamran.
Congratulations a lot. Okay.
Oh,
and I think you are the topper of Diet 3 2020.
Okay, I think it's time for me to go. I think it's time for me to
Diet 1, who will be?
Inshallah, Dr. Kamran will be top 169 out of 168 out of
And
169.
still Dr. Ansari result not came out.
Yeah, they are all they are all waiting, all expecting
Yes.
results also. And one last thing I can tell to you guys, just as a closing statement, safety netting. It's not as hard as you think. Wallahi ladhim, I can tell you that it's not as hard as you think. It's just how you practice. The more you practice, the more it will come to your fingertips. What are the questions to ask? And some places where, oh, my wife died, you know, doctor. Then because we are naturally searching for the diagnosis, we just okay. So do you have any other social supports at home? This, if you don't say you're sorry, they will minus marks here. So these things come with practice, and you tend to pick these things up when you do again and again, and again. We did how many cases per day? About 6-7 cases sometimes. Maybe something like that. And communication wise, again, I think we discussed my case, the warfarin case. We discussed beforehand.
Yes.
We discussed a warfarin case and peg tube also. Yes.
Yes,
we had our help of gastroenterologist Dr. Kamran to help us there also.
So we discussed a lot about with Kamran together.
Yeah.
Yes.
So,
okay, sir.
Dr. Nabil, just what I will say that 5 advices to our candidate. Okay.
Yeah. So number 1, so should I say so, or are you?
Yes.
Number 1, practice. Form a group. There are many groups. There are many
yes.
in Sir's group itself. There are a few candidates who have not yet found people. Better to find in the same group. That's how I picked up Dr. Kamran, Dr. Ansar. Same group, same people. So then you know you're following one particular standard, one particular way of talking, one particular way of examining. And we used to bombard Sir with a lot of questions when we discuss privately before our scenario, before our session starts. So form groups. There are many people who are waiting for some person to come. In our Sir's group itself, so form groups and
Dr. Nabil, I think it's a blessing for a candidate to find a good partner. Okay.
Exactly.
Finding a good mentor, finding a good partner, it's okay. But if you find a very good study partner, okay,
yes,
or you make a very good group, only 2 or 3 or 4 candidates together, and you practice, I think no one going to stop you from doing it. And if all are genuinely helping each other.
Yes, I must thank you, sir, for that. And also for the new candidates who are going to take for the first time, you might think, oh, it's very hard within 3 months. How can I clear this exam? I'm living proof with literally zero experience or literally very minimal experience. Even Dr. Naseem sir said me many times, yeah, this might be because of the lack of, everyone knows the diagnosis. I did not know the diagnosis because I didn't see this patient in my life. So that's there, but don't be worried. Just follow one particular mentor, follow one particular course, and then you will truly succeed. It's not as hard as you think, inshallah, and I pray for all your successes. Please
and try to means when you are in the group, not with me, any group, okay, if you find someone doing well, try to hold the hand of the partner, okay. Anyone, okay, a good partner is a blessing and it will your means work will be half, okay. You don't need any mentor also, frankly, okay. If you have a mature candidate who appear before once, so once you will appear, you know about the exam, okay. So if you find someone who appear before, okay, even means he's appearing second time, but he's 75% or 80%, he know everything about the passes. Anyone who appeared before and he did not clear the passes, I can guarantee you, okay, that he's similar and he can help you 80-85% pass the passes, and he know how to pass this exam. Once you will appear, until you will not appear, you don't know about the exam. Okay, only mentor can guide you that how is the exam, okay, everything. But once you appear, you know. Okay, so try to follow
one last thing. So one last thing to those who are going to sit the upcoming exam. One case I got in cardiovascular was a very, very difficult case. I discussed with many people. Still, we don't know the diagnosis. There was a left thoracotomy scar. So I told you, sir, this left thoracotomy scar,
yes.
and then there was clubbing. Apparently, that scar was not for a cardiovascular surgery, rather for a respiratory surgery. That I don't know. I did
by
not know
mistake
that.
they keep it. I think by mistake they keep it. They might
And
realize.
it really stressed me out because I said, first case is that case. So I literally was out, knocked out in the first case itself. But don't worry, I only lost 2 marks in that case because they will, if there is something like that, the examiners will be always helping. Communication cases, remember the surrogate, when you're asking unnecessary questions, the surrogate will pull you. Yeah, they are pulling you to pass. So they will say, no, doctor, I'm, if you forget that the patient is on warfarin, he'll tell, doctor, I'm taking warfarin also. So what should I do? They are reminding you, you're going the wrong track. Come again, come back. So it's not as hard as you think. Inshallah, you need practice. Nothing else, just practice. Keep on practicing. That's all I have to say, sir.
Okay, thank you so much, Dr. Nabil.
Welcome, sir.
Okay, we wish you best of luck for your future.
Inshallah, sir. And I'll remember you.
Okay, and thank you so much for sharing your experiences. Okay, when we are preparing, when I am myself preparing, okay, so it's means there are a lot of questions are there in your mind. Okay, so if someone share the experience, so still if someone have any question, you can ask Dr. Nabil. Okay. Otherwise, we will do a case. I think, is anyone there who passed the exam? I think Dr. Muhammad, are you there? He went for the prayer.
Sir, I have a question for Dr. Nabil.
Go on, yes.
Yes, Assalamu alaikum. Congratulations, Dr. Nabil. Would you please tell me that what are the cases you faced? Station 1, 2, 3.
Okay. So for cardiovascular station, I still don't know. It's query MR, query VSD. I still don't know because that scar was really a headache scar. So that's cardiovascular station for me. Neurostation was straightforward spastic paraparesis. They wanted that hereditary spastic paraparesis and multiple sclerosis because young patient. Don't forget multiple sclerosis. Wherever you can say multiple sclerosis. So they were expecting that. The white examiner was questioning, keeping on questioning, what else, until I come to multiple sclerosis. So that was my neuro station. And for abdominal station, I got straightforward splenomegaly. Patient was having CML. And for respiratory station, ILD, they wanted me, specifically they asked, what are the drugs that are causing fibrosis? So there are particular drugs that causes fibrosis at the basis specifically. So they were keeping on asking many drugs for me and what are the other causes that you can think of. So it was a smooth discussion. For long cases, number one was acute case was, I'll go chronic case. A chronic case was adult polycystic kidney disease presenting with hematuria. That was the acute case. The chronic case was hypothyroidism. So the patient is all wrapped up. The patient was looking the other side. She didn't even show her neck to me. That's how they wrapped the shawl and everything and looking that side. Until you ask to open the shawl and show me, she will never show the goiter. So, and I was talking to the surrogate only. So at last I understood that he's hypothyroid, but then I saw, oh my God, this is such a big goiter. So I forgot to ask her, how long do you have this goiter for? Or do you have this swelling for? Because I did not see that there's a swelling. So that was my case. And for communication, I got, I think I told sir, it was 45-year-old.
One is big tube. Video.
One is predictive, and other one is that's a little bit new, like little bit modified. Patient is on warfarin, subtherapeutic INR level, so they started subcut heparin, so enoxaparin, sorry, and patient had 2 episodes of melena, and now patient comes to you and says that she wants to go for a wedding, but she wants to go for a friend's funeral, and what are you going to do? What is the advice that you're going to give? That was the communication session. Other one was a predictive.
Okay, thank you so much, Dr. Nabil.
You're welcome, sir.
So, Dr. Tawqir, are you there?
Yes, sir.
Assalamu alaikum. How are you?
Walaikum salam.
Many
I'm good, sir.
congratulations.
Thank you, sir. Thank you so much.
So how you are feeling now?
Sir, yeah, I mean, very happy. Alhamdulillah. Big relief, actually. More than happy, it's a big relief, like, peace.
So, can you share your experiences and your advices to our candidate who is in the session today now?
Sure, sir. I will be very short and to the point. Actually, first thing is, I'm Dr. Tawqir. My center was Dubai, and this was my first attempt. I passed part 1 and part 2 in the first attempt in 2021, but then 2.5 years I was waiting for the seat, and then eventually I got the seat. So Dr. Naseem was doing a group, there was a going on. I went to my partner, so I will agree with Dr. Nabil about the partner and Dr. Naseem, that if you have a partner, good partner, you are blessed. So my Dr. Jawahar was the partner, and he was he's an amazing guy. So actually I traveled, I got the leaves from the hospital. So from Dubai, I traveled to Oman. I stayed in Salaline Hotel. So those 15 days, morning, evening, we were like practicing. And at that time, Dr. Jawahar was with Dr. Naseem. So I heard his sessions, and then I asked him that my exam is very near in 2 weeks, 2 to 3 weeks, so if he can give me time. So I asked for 2 hours a day. He gave me 1 hour. Thanks for that. And anyhow, so good thing about Dr. Naseem was like he was the best thing actually was like he writes on a paper when you are presenting the case, which normally people don't do that, especially the mentors. So he writes down where you use the jargon, where you miss the things, and when after you finish your case, he will tell you, and you have to correct yourself. So this was like, it was more a detailed feedback about every case. And second most important thing was like he knew what cases are going to come in Dubai. So we practiced. In fact, my case was psoriatic arthritis. So before the 2 days before the exam, he said, "Are you willing to do the case?" I said yes. So he said, "Okay, I give you case," and he gave me psoriatic arthritis. Next day, I also was not willing to do a case, because after that day I was having exam. I was in stress, so I did not want to lose the confidence. So and in exam I got the psoriatic arthritis. So then it was like I'm rehearsing it, and it was more confident. So anyhow, these were the 2 like important things regarding Dr. Naseem's course. Like one is he gives detailed, other is like he gives focused, center focused cases, which are there and they are appearing. So if you have exam in particular center, try to know what are the cases coming, and try to practice those. 80 to 90% of the cases they repeat. 100% of the overall cases they repeat. 100% the communication cases, at least 90% they repeat. And the questions are out. This is a paper. This is not like part 1, part 2. Cases are out, questions are out. You have to prepare yourself before the exam. Go into the exam with before the exam you have to be practiced so much that you already have passed the exam. And one thing Dr. Naseem used to tell me about my confidence, and the reason was like I was practicing every day, and I was like and I had done USMLE, and I have been through the international exam, like CS, I did in Chicago. So I knew this kind of format. So I was like confident that always international exams, the cases are the same, the questions are the same, even the patient's concerns are fucking same. I'm sorry for the word. So everything is same. So you have to just, go through, just practice them before the exam and then appear in the exam. A few things about the long clinical, like in the history, Dr. Naseem told me one day, 2 days before, prior to the exam, that I said about the time management. He gave me one tip that people don't follow, and I don't force them. But this tip is actually nice, which is like before social, you start examining the patient. So in my both clinical, one was thyroid, other was psoriatic arthritis. After finishing with the history, I went to examine the patient. I came back, I sat, and then I asked for questions like causes, complications, associations, red flags with both. And then after finishing this, I asked the social history. Still, I had time. Imagine. So then I again wanted to examine her to make sure that I have asked all the, seropositive, seronegative, inflammatory, mechanical causes of the pain. Then in the thyroid, I asked them for the causes like postpartum viral complications, for myopathy, for osteoporosis. Then the red flags like any weight loss, associations with autoimmune polyuria, polydipsia. So this tip actually, after finishing the exam, it in my mind, I was so confident that majority of the marks I have in my bulk. Like I have, you will know the case because you have time. You will ask the history, and the patients are very cooperative. So everybody gets the case. But the problem is, if you get the thyroid, okay, it's a hyperthyroid. People jump, okay, it's hyperthyroid. I got the case. Bye bye. They don't go into details like what are the causes, what are the complications, what about the red flags, what about the associations. So this was part of my scheme, which I believe was additive. And in fact, my both examiners, in one thyroid I got 28 out of 28, and in psoriatic I got 25 out of 28, and 2 marks they reduced because in examination a Filipino lady was there, and there was
Not
she was
examine
wearing
the back pain.
a sweater, and I was like and I asked her that, do you have back pain, do you have any heel pain, do you have any redness of the eyes? She said no, no, no. Then I was like, why should I examine the back? So they deduct my mark, one for that and one flexion extension. So they wanted me to rule out all the seronegatives. So I told him that I did not examine the back because she's a lady and sweater, and she denied any symptoms of back pain. But then he said, but you could do the flexion extension. I mean, there is no restriction on that. I said, yes, sir, agreed. So they deducted 2 marks for that. And one, I don't know why they deduct one more. So anyhow, 25 out of 28. So this is like my take home message, that examine before the social history. You will know, and examination findings equally carry marks. Most of the people fail in examination findings because they are short of time and they extend the history. And once you are the diagnosis, you go to exam and then you come back, social history, impact, smoking, alcohol, daily living, khalas, that's it. And then you start asking the concern. So my ladies, both thyroid and psoriatic, they had
Both are female, doctor. Both consultation.
Yes, sir. Female, but both were having like three concerns, and I answered them because still 2 minutes left was not heard. So until 2 minutes left, I was asking all the complications, associations, any other which comes in my mind, any other thing which I missed. I was filling up the gaps because I had time. So the moment they say 2 minutes left, this was the time I start. Okay, do you have any concern for me? Then they started, okay, I want to get pregnant. What medication I can take? What precaution? Can I get pregnant? Things like that. So is it treatable? Can my cousin is having this condition, rheumatoid. So is it rheumatoid? So then it was easy. So concerns, I got all full marks. So this is one point. Second point about the investigations and treatment. Investigation, it was part of my scheme. Investigation, basic. investigation and specific. In a specific, it was blood and imaging. So always before examine outside, when they give you 5 minutes. So this was my scheme. I was writing on a paper. And then I was seeing during asking the question that whether I'm filling up the gaps. So when you are writing, your brain knows what investigation you have to ask, you have to answer to the examiner, because you don't have time. You really don't have time to think and realize. So this was investigation. I used to divide into two parts, basic and specific, then specific into blood and imaging. Then the treatment also, like general treatment and the specific and general treatment we know. And then third part was treatment of the cause complications. So when you divide this and you tell this in this manner to the examiner, they are not going to deduct your marks. And I disagree with the previous candidate who passed about the books. Actually, books, like I did go to Gautam Mehta for like station 5, like endo and rheumato. But endo, I did only thyroid, Cushing, acromegaly, and Addison. And rheumatoid, I did systemic sclerosis, SLE, psoriatic, ankylosing, gout. So I did not, and dermatomyositis. I did not do all. And among those in Gautam, I just went through the case presentation and then the question and answer, not the page which completely tells. So trust me, those questions, like in COPD, he asked, what is the indication for inhaled corticosteroids? Anyone knows? I hope nobody. It is written in Gautam Mehta. It was written like two admissions in 2 years due to like in 1 year, 2 admissions requiring antibiotic. This is the indication, and FEV1 is less than 50% in both admissions. So I told him, and he gave me 20 out of 20. So in abdomen also, like there was she asked me, okay, all the questions she asked, then asked, okay, it was polycystic kidney. What is, if the patient is coming with refractory pain, no, recurrent pain, what you will do? Spontaneously from my mouth came nephrectomy without saying analgesic. Normally if there is a pain, refractory pain, what you will do? You will say, I will give analgesic, I will go opioids or something like that. I spontaneously said nephrectomy. And I was in shock. That did I miss anything? I said her to a white lady examiner. She said, no, you perfectly answered, and I got 20 out of 20. So Gautam Mehta, like for the station 5 and for the clinical, especially the question answers and case presentation, those 5-6 lines. So, and selected, very selected, focused. And Dr. Naseemul Huda, because he knows the exam specific scenarios. Trust me, and if I give you one more tip, ask those candidates, suppose I'm in Dubai, ask those 2, 3, 4 diets who has gone through the same exam. Ask them what cases came, how was the patient looking, like black patient, white patient, any sign were there. Like one of Dr. Salah is here. There was a clinical course I attended. So there was a Filipino lady who was having thyroid, was also same Filipino lady. Anyhow, Dr. Naseem knows it. Same Irish lady. So there is a polycystic kidney disease, and she's a Filipino, and she has a catheter in the chest, double lumen catheter. So that is for the dialysis. And first thing I did abdomen, like I started with the pedal edema. I saw pedal edema. Palmer, I saw like it's paler. Then I said I want to see the lymph nodes. And lymph nodes, when I went there, I saw it was covered with the shirt. So, some catheter. So I looked at examiner, there is some catheter. She said, yes, you can have a look. So I looked at and I shouted like, oh, this is for dialysis. So, and she gave me a smile. Then I realized, how did I come to know? Because previously, last diet, same patient came, Filipino, with the dialysing catheter. So then it rest was like, maneuvers. Like I knew the case is a polycystic. I knew it's on dialysis and stage renal disease. I just completed the abdomen, and then before the time I said, I am done, you can start the question, and they started the question. So I got 20 out of 20 in that as well. So what I want to tell that, ask the people who have appeared in the same center prior to you, focus center, cases would really help you. That's all from my side. And sir, I'm really sorry. I'm in the clinic and I have
Yes,
a patient.
so
Actually,
thank
my
you so much
phone is
for
ringing.
talking.
So thank you, sir. Really.
And I
appreciate
still remember
it.
when I told you, Dr. Tawkir, where are you? When we are doing practice, you told me I am sitting in the Starbucks.
Yes, sir, exactly, sir. Always in standards.
So thank you so much for joining our session and giving advice. Okay, so you are on the duty and you have spared some time for our candidate. So thank you so much, Dr. Tawkir again. Dr. Muhammad, are you there?
Yes, I'm there.
Big congratulations, doctor.
Thank you, Dr. Nassim. Thank you.
So can you share your experience, doctor?
Actually, first I have to say, Alhamdulillah, thanks God, Alhamdulillah for passing basis. Alhamdulillah, and congratulations for all those who passed, and for those who don't do it, inshallah, next time they will do it, inshallah.
Yes.
And for those who are and those for were appearing, inshallah, wishing for them all the best, inshallah, and also to make it from the first time. So regarding my experience, actually, this alhamdulillah is my first time to go for basis in exam in Dubai. Alhamdulillah, I cleared it. Actually, my experience is that I start preparing actually for basis after I got a seat, because I was not sure that I will get a seat, because there are a lot of people who are applying and be rejected. So when I got a seat, this now became for me like a red flag, so that you have to work hard. But the point how to work hard, this was my concern, from where to start, where to read, and what to do. So I take advice from those who did the exam, and my friends. They told me it is a matter of practice, but not only just theory practice. It should be practice in a very professional way. And I remember one of them told me, you have to become like Messi or Ronaldo when they're playing football. So they are dragging all the players behind them. So what to do in the exam, you have to drag the examiner behind you, not to give them a chance to attack you. Okay, and I follow the advice.
Very example.
Yeah. So my tips, tips of advice for those who are going for the exams. Usually, we have two personalities or two characters. Characters for the exam and character for the real practice in the hospital. So we need to make them one character. So whatever you practice in the hospital, you have to do in the exam. This first advice. Second advice. Whenever you go to the exam, you have a ready-made plan for the exam. Okay, what I mean by what I mean by the ready plan is that to know what you will do, what you will say, and what you will practice, and what you will do inside the exam. So fair thing. Your history and examination, you should keep in mind the patient age and gender, and sometimes ethnicity, which help you regarding the differential diagnosis. Number one. Number two, you have to keep in mind common is common, and the uncommon presentation is more common for the common presentation of uncommon cases. I don't know. So for uncommon presentation, for example, you have to mention uncommon presentation of tuberculosis before you mention the common presentation, for example, of sarcoidosis.
Correct. Very good.
Okay. Yeah. Okay. Third thing, the diagnosis which you don't look for it, you will not search for it, whether in history or examination.
Correct.
Okay. And the fourth thing, and your differential diagnosis should be based on the clinical data, which is patient age, gender, ethnicity, and the complaint of the patient when you go to consultation, long consultation scenario. Okay. What I mean, for example, if in the long consultation, is the history is short duration, this means you have to put, like example, vascular causes first, second infection like this. If it is chronic presentation, So you have to look for the long run disease like chronic disease, metabolic disorder like this. So the point, why? The point, this will help you to know your differential diagnosis and make you reach the diagnosis easily instead of putting a lot of differential. So I can give an example. For example, if they give you a patient came with generalized fatigability and snoring, for example. In this case, you have to look, this patient is male or female, if he's young or old. And based on this, you can order your differential diagnosis, because here you can reach easily. I myself, in the exam, my experience was in the long consultation. When I took the paper, after reading the scenario, I wrote by side my differential based on what is mentioned. Young patient who came with what the complaint. So I put my differential, and based on it, I ask and I finish. I finish my differential early. Okay. Other tip of advice is that you have to follow the step of examination like MBBS student, but you have to do the clinical examination as a professional. I don't know, is it clear? I don't know this point or no. So you have to follow the steps of examination like MBBS student, inspection, palpation, percussion, auscultation, but you have to do it in a very professional way so that you can pick up the sign. Okay. Regarding the long consultation, sorry, before in the clinical, sorry, I have to go back for the clinical station. So based on the patient age, you can decide where you will go. For example, if they give you in the cardiovascular station, if they give you elderly patient, this most likely aortic stenosis or valve replacement. If they give you a young patient, most likely this pure rheumatic heart disease. So by general look on the patient, you can know from what will be your differential diagnosis. And for example, I will start with my cases. It is the same as Dr. Tawqir, because we, by the way, congratulations for him, because we examined together in the same batch, the same day. So it was the same cases. For me, actually, cardiovascular, actually, I thought I missed the case, because they asked me to re-examine the patient. So I thought in this case, maybe I lost this station, but when I got to next station, I dropped back, because they said if I miss this, I have not to miss the other. So as I think the message here, every station you finish, put it in your behind and go forward. Okay, whatever you did on it. Okay, and the neurology, it was lower limb weakness. The asthma differential was proximal myopathy. What was the differential of proximal myopathy? The consultation was thoracic arthropathy and thyroid. So my message for the long consultation is what? Try to finish the history and history within maximum 8 minutes. Try to finish your examination 3 to 4 minutes. You have to leave by 11 or 12 minutes. You have to finish everything. So you have to leave the two remaining minutes to manage patient concern. Okay, and try to focus on patient concern. Try to elaborate more on it. Okay, number one. Number two, try to formulate a plan of management which is easy digestible for the patient and the examiner. Okay, when they tell you 1 minute remaining, here, this 1 minute, this you have to do what you have to add some flavors to what you have did. Okay. For example, this is what I did actually in the exam. When they told me 1 minute remaining, I told the patient, I'd like to assure you regarding your problem, we will help We'll do our best to help you. And as I mentioned you earlier, we'll do 1, 2, 3. So I repeat for him and give him like a psychological support. So I think what is important in long consultation is catching the history early, confirm the clinical finding, and you have to pay most of your attention to the part of communication skills and managing patient concern. And one of the things that whenever you have any female patient in long consultation, okay, don't forget to ask about gynecological history, and don't forget about her plans for pregnancy, because this can change a lot of things in the plan of management, especially if she is pregnant or going to get pregnant, regarding, for example, introduction of medication. Sometimes with stress in the exam, you can forget easier to ask about gynecological history. But I think this is a learning point, that whenever you have any female, right by side that gynecological history, you have to ask about.
Yes.
History of pregnancy, abortions, contraceptions, and any plans for pregnancy, and whether there is any drug interactions with the pregnancy. Okay. So this is a communication. Long consultation, actually, it's like a story, which you can make it favorable story and easy digestible. And after that, after finishing all the scenario, you have to put the 20 marks in your pocket and go out. Okay. Regarding the communication, I myself, I simplify it as it's a problem which you need to discuss with a surrogate or with the patient, and you have to explain to him all the aspects of the problem, but you have to have a shared plan of solving the problem. The plan of solving of this problem should not be unidirectional. It should be bidirectional, and you should do your best to agree to make the patient agreed on the plan. Okay.
50,
and you have sorry,
means 50% you will talk, and 50% or 40% let surrogate also to talk during.
Yeah, you have to give if you have to give the surrogate his full chance to express whatever he wants.
Yes.
And never try to make any confrontation with the surrogate, but try to drag him to your side and support whatever he said, and then put your fingerprint on it. And this comes in which scenarios? Usually in the scenarios of refusal of treatment, of or incompliance with treatment. And this you have first to put the patient, the surrogate on your side. After that, try to convince him. Okay. So I think that my conclusion for my experience is that BASIS, it is not a nightmare exam. BASIS is a daily practice, a daily hospital practice, but with some flavors needed by the examiner. The candidate, the one who can make it spicy, who can make it sweet. So and the point that for the practice, just you need a guidance and skeleton so that you can follow and apply. And my last advice for those who are going to exam, any case you meet in the practice and your daily practice, try to make it a BASIS case. For example, if you have a chest, your patient came with cough, deal with him as chest. Examine all the steps of the chest. Okay, I know you already know that should be within 6 minutes and all this, but the most important thing is to follow the step of the exam. And for example, this is a clinical. Whatever case you have, try to make it like a BASIS case, and try to make a communication scenario. For example, even whatever you have any patient, try to make him like a communication scenario, and try to make him like a long consultation scenario. Okay. First time, you may take like 30 minutes to finish, no problem. Second time, it will be 25. Third minute, third time, it will be 20. Every time with practice, will be less and less because practice is a secret of success. But not only like this, but with a professional way and in the way that you know how to success, how that you can reach to the goal quickly without any interference or interruption from the examiner. So it is practice, practice, practice. And so for those who are going to exam soon, so they have to start from today or instead from tomorrow to deal with every patient as they are seeing as a basis scenario. Clinically or communication or consultation.
Try to practice common cases, those coming in exam. Hopefully, common is common.
Yeah.
Will come in the exam.
Definitely, common is common, yeah. And as Dr. Tawkir said, the cases which we got was a common scenario in the exam center. It was thyroid, it was throat neuropathy, yeah. So common is common, and usually when you do try to put the finding in a way that reach to the diagnosis, even not all, and try to manipulate to make it so that you can reach the diagnosis. And just one thing I want to say, you have to do exposure whatever the case you have. The case of the polycystic kidney disease which we got, usually I got the diagnosis from when they were hiding the jugular catheter and beneath the patient clothes. If I didn't expose, I will not see the catheter, the jugular catheter. From there, I know that I'm going to deal with a renal transplant or polycystic kidney. So exposure will help you a lot to know what you are going to deal with.
So thank you so much, Dr. Muhammad, for giving so much input. Okay, and definitely it will going to help the candidate. Okay.
Thank you, doctor. Thank you.
Okay, very good. So you give a very good detail of how to practice and how to prepare for the exam, and every station you explain very well, doctor. Okay, so thank you so much, Dr. Muhammad.
Thank you, doctor. Thank
you so much. May Allah reward you, inshallah, for that. Okay, so
thank you.
Okay. So I think we are late now today. So we will have session tomorrow. Okay, we'll try to do one consultation tomorrow. So anyone who did not do a course with us, want to do the practice, or anyone want to do the practice, just text me. We will have a session tomorrow. Okay, we will try to discuss one consultation session. So thank you so much. Okay. Everyone for joining the session, particularly those candidates who pass and share their experiences. Okay, thank you so much. So if you help others, okay, God or Allah will help you definitely when you are in the need. So thank you so much. So I will end our session today and we'll see you tomorrow.